So welcome back. Now today we will be learning about why certain things are done a certain way when it comes to stroke recovery. And to better understand that, we actually have to figure out how we even got here. And if you haven't done so already, it is a great time to view the Basics Part 1 and 2 videos in the Medicine series to better recognize some of the words and ideas that are used here today. Now, today we do know that strokes happen because a certain part of the brain doesn't get blood suddenly. And this happens either when the blood vessel going to the brain bursts, causing a hemorrhagic stroke, or the blood vessel going to the brain gets clogged, such as an ischemic stroke. The ischemic strokes are much more common, and we have amazing medications and procedures and surgeries to help treat these. And we now even focus on things that either cause the blood vessel wall to weaken and burst or the blood vessel to become more narrow and clog easily. So we now know that if we control the diabetes, the high blood pressure, the cholesterol, and the not smoking part, these patients can do better or even prevent the stroke in the first place. And we also have amazing rehab that helps patients recover or regain some of their function. But this was not always the case. And if you look back in history, about 3000 BC, the Egyptians knew about strokes, like they knew they happened, but they didn't know why they happened. But they did describe the suddenness of it and that afterwards the patient may need an aid in walking, etc. But it wasn't until our friend Hippocrates in about 400 BC where he describes these patients getting suddenly struck with an affliction, after which they have sudden paralysis. And he calls it apoplexy, an ancient word, apoplexy, meaning sudden. And then the Persian physician Avicenna in 1000 AD is able to do autopsies at a time when it wasn't that common in the world. And he's able to find out that there are two different ways that this sudden lack of blood flow to the brain can happen, the hemorrhagic and the ischemic pathways. But really, the treatment for stroke all through this time was pretty much the same, in that the focus was on having the patient rest, laying flat, getting more blood to the brain, and having them avoid any stress or any high blood pressure issues. But this all changes in the late 1800s with Dr. Heinrich Frenkel. He's a Swiss neurologist. He's born in Switzerland. He goes to Germany, studies, he comes back to Switzerland, and he opens up shop. And in his clinic, he has a patient who is a farmer one day who fails the finger to nose test. Now, the finger to nose test is a very simple test where the doctor will usually put their finger out front and the patient has to touch their nose and the finger and their nose and the finger, and the doctor keeps moving the finger back and forth. And when a patient fails this test, meaning that they don't do well on this test, it means that a certain part of their brain isn't working. And it's not only not working in and of itself, but it's not working with other parts of the brain. It's not able to communicate very well. So when the farmer asks Frankel what happened, Frankel says, well, you've had a stroke. You need to now go home and rest and avoid stress, etc. Well, in 3 months, the patient comes back and he does the finger to nose test perfectly. And Frankel asks him, what did you do? And the patient says, well, I knew you were going to do this test again, so I practiced every day. And Frankel was very interested in this because as a neurologist, he had seen some patients after stroke that did better than others. And he was very interested in why this was happening. So he actually takes this idea, which we now today call neuroplasticity. And neuroplasticity means that the brain, when a certain part of the brain doesn't work, another part of the brain can take over its function. If you think about it, it's kind of like if you have a bunch of roads, but you have one main road and the main road is blocked. Well, you also have side roads that you can now use to still get from point A to point B. And in this case, what happens is the brain does have these side pathways, but they just have to be strengthened through repetition. So Frankel opens up a rehab house. He puts like bars to help patients walk, and he makes chalk marks on the floor where they're going to put their feet. He lines it with mirrors so they can see what they're doing right and wrong, and to try to see if he can replicate this solution in other patients. And at the time, the medical community actually mocks him. Other physicians say, this it will not work, this will not end well for you, this is not good for the patient, etc. But he's successful and he stays focused and he takes the things that he has learned and he presents it at a medical conference within a few years. And a few years later, doctors from around the world are actually coming to his rehab house to learn the techniques so that they can use it in their own patients. And then Dr. Frankel goes down in history as the father of rehabilitation medicine. Now, this method that Dr. Frankel uses is what is happens a lot in medical advancements today, where there is a medical problem and the solution is not as obvious, but the solution is found, and then it has to be replicated to make sure it's not a fluke just in that one patient. And then you take that knowledge and you share it with others to improve the lives of many. Actually, and in this case, the lives of many other stroke survivors like myself. As the writer, but also the doctor, Anton Chekhov would say, knowledge is of no value unless you put it into practice. Until next time.